are continuing our discussion about symptoms. Let's understand what causes symptoms. We've said, well, it's a physiological change. If we could perhaps measure bad symptoms as opposed to good symptoms, symptoms indicating that we're sick rather than symptoms indicating that we are just going through adaptative change. Now, sometimes those symptoms will be so extreme that we can recognize the difference. Other times we'll just observe them. We can guess at the difference, being as right or wrong as anybody else who guesses at the difference. But talking for a moment about these hypothetical bad symptoms, symptoms meaning that you're sick, what would cause those? Obviously, a failure of the body to adapt to something in the environment. Maybe some food we've eaten that was tainted, maybe some particular virus or bacterium which is new to our body, to which it takes us a greater period of time to adapt. Symptoms are brought about by a temporary inability of the body to adapt to some circumstances in our internal or external environment. That can be caused by one of two factors. The first one is that the resistance of the body is lessened. When the resistance of the body is lessened, then normal environmental demands prove to be too much. What can cause lowered resistance? Number one, vertebral subluxation. But that's only number one. Somebody else talked earlier about nutritional deficiency. Let's add lack of sleep, poor mental attitude, the fact that we are already undermined by some other disease or disability. How many times do we hear of an elderly person stepping off a curb, breaking a hip bone, and 2 weeks later they've died of pneumonia? Where did pneumonia come from? Did a virus get in through the break? No, normal viri, but their body is now unable to adapt because of the shock. Shock is a recognized factor in worsening any condition. It is in and of itself a cause of death. Shock is peripheral circulatory failure. And that will accompany any sudden illness or accident or injury and can lessen the body's resistance to other things. So there are a whole number of things that can lessen the body's resistance. We've named 4 or 5. There could be many more. The other factor which would cause the development of symptoms is a normal person with normally high resistance confronted with adaptative demands beyond the capacity of even their healthy body. Once in a debate with a physician, he said, well, would you let me inject the, I think he was talking about the syphilis microorganism. He said, would you let me take a syringe full of the Spirocheta pallidum and inject them into your bloodstream? Thinking, well, if you have faith in your chiropractic, in fact, that's what he said. You go to your chiropractor and get unsubluxated, and let me shoot that into you. We'll do an experiment if your body's immune to these things. Hey, the body's not immune to things just because you're unsubluxated. All it means is that your body is able to function at its highest capacity, all other factors considered, like nutrition and rest and exercise and mental attitudes and love and all of the other things, the measurables and the immeasurables. Taking all of those into account, vertebral subluxation is one factor which lowers your resistance. And if all factors are at their highest peak, you've never had a day in your life when you've failed to get enough sleep, or when you breathed in too much smoke, or didn't get adequate nutrition. You've never had a day in your life when you've abused your system. Even then, you're not immune to everything, and we could shoot organisms into your arm and they kill you. I said to this physician, would you let me shoot hamburger into your veins? What are you saying, that hamburger is the cause of disease? Although if you go to McDonald's, maybe the answer to that is yes. But the point is, neither hamburger nor Spirocheta pallidum is meant to be injected directly into the bloodstream. Your body is not immune to everything. It's possible to so poison the environment that unsubluxated you can't survive. There are two causes that will make somebody sick. One is a lowering of the resistance by all of the factors or any of the factors that we mentioned. The other one is a dumping into the environment such a vast quantity of negatives that even the strongest body can't resist them and overcome them. I would venture to suggest that in most cases, somebody getting sick is probably a combination of both of those. It's like a balance scale, isn't it? Positives on one side, negatives on the other. When there are too many negatives and not enough positives, you get sick. Now maybe with the passage of time, your body can develop more defenses, more resistance, and gradually the balance is once more restored. When you get sick, all of a sudden you decide to get a decent night's sleep. I don't feel like going out boozing tonight. I need my rest. Or maybe you'll start listening to your body and not taking in too many McDonald's burgers. Maybe you'll eat decent food for a change. Somehow we tend to listen to our body a whole lot more when we're sick. And now with the passage of time, the body can build its defenses and adapt better to some of the changes in the environment. But it's still not without limits. Remember we said every property has limits. Or rather, every substance has properties which are its limits. Every substance, including the substance of which the body is made, has chemical properties which are its limits. The innate intelligence can only work with the substance of the body, and it is limited. Innate intelligence is unlimited, but the substance through which it works is limited. Furthermore, another very important, we call it a chiropractic principle. In fact, it's just an observation of universal law. There is no process that does not require time. So when your body is invaded by some heavy dosage of an organism, somebody sneezes this new virus into your face, or you get exposed to this new AIDS virus, your body has to take time to make defenses. How much time? Nobody knows. Speaking of AIDS virus and the law of cause and effect, I'm fascinated by this. Are we to believe in the world of science, which says there is no effect without a cause, that AIDS virus came from nowhere? I learned that if a new virus developed, something caused it to develop. And instead of saying, hey, aren't we unlucky this epidemic came, or blaming the gays in San Francisco, or the Haitians, or the Africans, maybe we should be looking at what changes we have made in our environment that has caused a mutation of a virus, or the development of a new microorganism. I don't know anything more about AIDS than you do, but I do know that it is an effect and something caused it. And the longer we go around changing our environment, polluting it, putting into motion causes whose effects we don't know, the less we should be surprised when the effects are unpleasant. I would like to set up a standard for altering the environment. If you don't know what the effects are going to be, then don't do it. If you can measure the effects into the next 1,000 generations, then it's okay to go ahead and change the environment. Until that time, I am going to assume that the creative wisdom of the universe that put it all together and holds it all together knows what the hell it's doing. And these stupid little scientists that go around trying to improve nature are setting causes in motion whose effects we may not like when they come through. You know, in recent years, the last 50 years, there's been a tremendous increase in the number of cases of cancer. Some of our medical friends would have us believe, well, we just got better at diagnosing it. To which, if I weren't more polite, I'd say bullshit. It's true they got better at diagnosing it. But also there are more cases caused by chemical violations of our environment, of the food we eat, the air we breathe, the water we drink. We're putting carcinogens into our food chain. And then we're surprised when people come down with cancer. Boy, we're going to find a cure for cancer. No, we don't. We don't have to find a cure for cancer at all. What we have to do is stop changing our environment without knowing what the results of these changes are going to be. All right, let's get back to our discussion of symptoms and cycles and putting more negatives in than the positives can handle. As long as we are putting into our environment unnatural causes to which our body has not adapted, we must expect sickness and disease. Eventually, 2, 3, or 20 generations later, we might adapt. But it will take that long. You see, when we shoot people up with antibiotics to kill off Staphylococcus, as we said, that's great for the Staphylococcus who get a fatal dose. They die. But those that don't quite get a fatal dose survive. They manufacture their little enzyme, which we label penicillinase, and say, aren't they clever? And then they breed new generations of staphylococci, which the body has not experienced. And we say, why can't the body adapt? The innate intelligence of the bacterium is smart enough to adapt. Why can't we? Answer, we can. The bacteria do it in 24 hours because that's how long it takes them to go through 10 generations. And it takes us 80 years or 800 years or however long it is to go through enough generations to adapt. It seems that we are rather complex organisms, and it always takes generations to adapt. As long as we go through a generation every 20 years or so, we're going to be very slow at adapting compared with the flies to DDT, because those flies, they just breed like flies. And so do the bacteria. Our bodies are constantly going through physiological cycles which will produce symptoms. We will adapt, the symptoms will change. If we keep ourselves as strong as we can and keep our environment as free from negatives as we can, then we're going to have a pretty good chance of survival. One of the things we must do to keep ourselves as strong as we can is to remain subluxation free as much of the time as we can. The damage from vertebral subluxation is cumulative. To have a vertebral subluxation for an hour is bad. To have it for a week is worse. To have it for a year is much worse. None of them may be fatal. But how many months or years do you have to have vertebral subluxations before your resistance is weakened to the point where the current changes in the environment will destroy you? Answer, I don't know. I know, let's take a chance. Yeah? Let's find out. Let's go walk around with subluxations for years and see. People will tell you, hey, I've never been to a chiropractor and I'm 97. Now, if they had gone, they wouldn't be 98. They'd still be 97. Remember what we said about taking 2 aspirin that knocks 10 minutes off your life at the far end and you don't notice it at the time? So it is with vertebral subluxation. When people tell you, hey, look, I don't go to chiropractors and I'm healthy, first of all, they have no way of measuring their health. Healthy people have a nasty habit of dropping dead so that rude facts destroy pretty theories. But also, you don't know what condition they would have been in if they had been subluxation free at least some of the time. Now, let's talk for a moment to the chiropractors about you and your family. Just because the public is too dumb to come in when they should doesn't mean you and your family have to do the same thing. You know better. When do you get your own spine checked? I'll tell you something else. I don't want to get checked by a chiropractor who is subluxated. I don't want to go to a dentist who's subluxated. I don't want the guy making my pizza if he's subluxated. I don't want police out on the street carrying a gun if they're subluxated and can fly off the handle at any minute. How long do you have to have a subluxation before it undermines your health and your resistance enough that you're going to fall victim to the current environment? You know, it's very difficult to control your environment these days. You got thousands of government employees and factory owners and others working diligently to destroy your environment. And here's you trying to survive. And I'll tell you this, you don't really have a fair chance of surviving if you don't keep yourself subluxation free a great deal of the time. How much? How much of the time do you have to stay subluxation free? I don't know. How many hours of subluxation out of 24 will it take to destroy you in a 10-year period? I don't know. I'm not even sure that vertebral subluxation is a 24-hour thing. I've never checked anybody constantly over a 24-hour period. Could be that somebody who has vertebral subluxation has the thing tend to slip in and out periodically through the day. In which case, if they're subluxation free more of the day and subluxated less of the day, they're better off. All of which will help them to adapt. But adapt doesn't necessarily mean be subluxation free. Adapt doesn't necessarily mean be symptom free. Even people who are subluxated adapt up to a point. People who have no subluxations get symptoms. And here's the worst part. Sometimes people who become subluxation free find an increase in their symptoms as a result of being subluxation free. We talked about the person with a temperature who now becomes subluxation free, and the temperature goes up as the body does now what it couldn't do before. Let's talk about adjustment reaction as a cause of new or increasing symptoms. Patient comes to you who has been in an automobile accident, the muscles of the neck are very sore, some are in spasm. That's all. No other symptoms. Any pain running down the arm? No. How can they have pain running down the arm? The sensory nerves that carry the impulses of that pain are interfered with by the subluxation. Remember, subluxation can interfere with three kinds of nerve impulses: motor, sensory, and trophic. Motor impulses are the ones that make the part work. Sensory impulses are the ones that carry information from the part back to the brain for interpretation. Trophic impulses are the life energy. If you interfere with the motor impulses, the part doesn't work too well. If you interfere with the sensory impulses, you deny the brain accurate information. Now, irritating sensory nerves could cause pain, could cause burning, could cause heat. Pity these poor physicians or chiropractors filling in insurance reports who have to describe the type of pain. Well, it's a pulling pain, it's a burning pain, it's like a pushing, it's a swelling pain, it's a tickling pain. All these silly descriptions because you can't define feelings. How about the very slight tingling pain of a nerve that's irritated, but so irritated that it can't carry a full impulse? Until some chiropractor comes along, locates and identifies the subluxation, puts in the technique whereby the body makes an adjustment, and now the person begins to feel for the first time the pain he should have been feeling ever since the accident. And they come into your office the next day and say, "What the hell did you do to me? You made it worse. Now I have pain in the arm. Before it only felt weak, or before it was only kind of tickling. Now it really hurts. Now I can't lift anything. You made me sick." And if you want to get rid of these new symptoms, the easiest, quickest way is to just subluxate them again. Cut off the nerve impulses. How do you feel now? That's wonderful. Huh? That's the medical doctor's technique, isn't it? Deaden the nerves. Take 2 aspirin. Call me in the morning. Shoot them up with heroin. Get rid of the sensation. Get rid of all pain. They really feel no pain then. Chiropractic sometimes causes discomfort or pain or symptoms by allowing the body to experience what it couldn't experience before. When the subluxation is gone, you've had these little kid coming into the office with a bellyache. Well, why not? He's eaten 8 green apples. He should have a bellyache. Till you get him on the technique table and you get rid of his subluxation, and all of a sudden he doesn't have 8 green apples in there anymore. They're all over your floor. Huh? Oh, you made him sick. No, I didn't. I allowed him to become well. I allowed him to get rid of the poison. But hey, you gave him a new symptom. You gave him vomiting. You gave him diarrhea. You gave him pain. Some chiropractors practice limited area techniques. I'm not getting into a technique discussion now except to illustrate a point. By limited area technique, I mean a technique which addresses itself to a single vertebra or a single area of the spine. Let's talk about the upper cervical only chiropractor for a moment. And if there are any in the room, they'll confirm what I'm about to say. Sometimes a patient will come in complaining of any kind of symptoms or complaining of no symptoms. You analyze the spine, you find subluxation at atlas, you put in your toggle recoil, subluxation is gone to your satisfaction. They come in the next day and say, boy, my whole back hurts now. Now, if you're a full spine chiropractor, oh God, I hit him too hard, I bruised him, I made him sore, I'll change my technique. The poor upper cervical chiropractor didn't even go near the back and he's getting the blame. What happened? Well, the body adapts to the presence of subluxation. After the subluxation was in there, over a period of time, if the body can't eliminate it, I know I'm intruding upon next week's discussion, but we'll have to do that anyway, it is the body's job to get rid of the subluxation. If it can, it will. If it can't, the next best thing it can do is to adapt. Maybe move the other vertebrae a little bit out of line, put a little curve in there to lessen the strain at the point of subluxation, which we have already established here is atlas in this particular case. Now, over 10 or 15 years of being subluxated, the body fits quite comfortably to its new adapted situation. Until you come along, and as a result of what you did, the subluxation is gone. That artificial positioning of the vertebrae is no longer needed. It was there to adapt to a subluxation. Subluxation's gone, the adaptation isn't needed anymore. So the body will straighten out the curve. What does it use to do that? Muscles. The only thing the body has to move bones is muscles. Yeah, but these are muscles you haven't used in 10 years. What happens when you go home and paint the ceiling when you haven't done that action for 10 years? You get a Charlie horse, don't you? You get sore. When you use muscles you haven't used for a long time, they get sore. And that's what happens when you check out subluxation, as a result of which the body undergoes changes and uses muscles it hasn't used in years. And the patient comes in and says, boy, I'm so sore. What did you do? You didn't do anything wrong. You did everything right. Now, that does not mean that every time a patient comes in and says, I hurt today and I didn't yesterday, doesn't mean you can say, that's wonderful, I did that. Because you don't know what's causing his pain. That's the trouble with pain or symptoms. Nobody knows what the hell is causing it. You can come in and explain it's all due to this subluxation of the atlas and that's gone. You say, well, I thought it might have been because I slept at my cousin's house on that rotten bed of theirs. Yeah? And it might have been that. You don't know what caused their pain or their lack of pain. You do know that the body changes when it goes from a subluxated condition to an unsubluxated condition. It can very easily develop symptoms. Now, are you going to decide whether they're good symptoms or bad symptoms? The patient wants to know, why is my back hurting me today? And we, with our grand egos, try and pretend we know the answer. And we make up answers. We play medical doctor. Well, it's hurting because of thus and such. 2 or 3 days and that'll go away. 2 or 3 days it may be worse. Why don't we tell people the truth? I don't know why your back is hurting you today. I'm not a backache doctor. I'm a chiropractor. My job is to help you to become subluxation free. And I'll tell you this, checking your spine today, you have less subluxation today than you had yesterday. That's an improvement. Now, what's causing your backache? I don't know. Hey, they could have developed cancer and this could be the first sign of it. It could have been they had cancer all along and were so upset with their neck pain they couldn't feel the cancer symptoms. And now all of a sudden it's there. By what right do we tell people what's causing their pain when we just don't know? Even a simple backache could be caused by cancer of the prostate, could be caused by kidney stones, could be caused by passing a kidney stone. Maybe as a result of what you did with that subluxation, they're now passing stones. Will that go away? I have no idea. Will they be able to pass it successfully without surgery? I have no idea. Let's not make guesses about the body when we don't know. What we should be prepared to do is tell the patients the truth, including that wonderful answer, I don't know. What I do know is that you have less subluxation today than you had yesterday, and as I explained to you, that's the condition I'm trying to achieve. Now, whether your pain is associated with that or not, there's really no way of knowing. And that's true. There's no way of knowing. I think if you explain things to people reasonably and intelligently and admit that there are things you don't know and don't try and play God, you're going to be a damn sight better off than making up answers when you don't know the truth. But please don't believe that when your patients become subluxation free, all their pain is going to go away. And even worse than that, remember, some of them are going to experience brand new pains they didn't have before or weren't aware of before, as the body goes through changes. I remember seeing one, a very quick adjustment reaction. And that was a little girl who'd been running a low-grade fever for about 6, 7, 8 weeks. Kept going down to the obstetrician. From where she lived, she had to pass my office to go to the obstetrician or the pediatrician on the next corner. And the mother took her down to the pediatrician, who gave her some treatment, some medication, brought the fever down. The kid would go home 3 or 4 days later, the fever's back. Low-grade fever, nothing serious. Kid was a little cranky, off her feet, slightly runny nose. Never really sick, but never really well. After 7 or 8 weeks of this, a neighbor had said, hey, why don't you take her into Reggie? So she came into my office. Reggie, get rid of the fever. Reggie, get rid of the symptoms. Reggie, make the kid well. And we did a whole orientation. We explained all the things that she didn't listen to a word, and we sat and explained it, and she said yes, 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 in all the right places. You don't teach people, you don't change their way of life in one visit. But when I thought she understood, I wasn't going to wait until she was completely educated before I started to work with a child. Could have waited 6 years for that. And here's the kid running a fever. So we put the kid on the table, we checked the spine, made our chiropractic technique, and as so often happens, the temperature went up. One negative change in symptoms, one increase in symptoms. Much better than that, as she sat there on the table, she started to sweat, she started to get red. Within 15 minutes, she was covered from head to toe in the most beautiful bloom of measles you have ever seen in your life. For weeks, her little body had been trying to generate whatever it takes to develop the rash and get rid of the measles, instead of which they kept putting drugs in her to bring the fever down and not let her get rid of the measles. So, did I give her the measles? What did you do to her? Did you make her sick? No, that's not sick. That's well. The body's doing its job. This is a typical adjustment reaction. Now, you cannot expect to identify adjustment reactions. When a person comes in the next day and they're sick, you really don't know if it's an adjustment reaction, a technique trauma, retracing, or something totally unrelated. But there are certain things you should know about adjustment reaction that might give you a little peace of mind and understanding at the time. Adjustment reactions tend to occur only after the first or perhaps second visit of a new patient. Somebody who's been subluxated for many, many years is likely to experience adjustment reaction the very first time the interference is released. You see, the innate intelligence doesn't know how long it's going to remain subluxation free. You say, hey, why can't the body raise the temperature slowly and get rid of the measles this way? Hey, the innate intelligence doesn't know how long it's going to stay subluxation free. It knows its job is to get rid of something. When the little kid who ate the green apples is now able to dump them on your rug, innate intelligence is going to do it right here, right now. It doesn't know that, hey, there's lots of time the kid can go home and ruin his mother's rug. Innate intelligence works when innate intelligence sees fit to work. So what that means is adjustment reactions usually take place almost immediately after the first or perhaps the second adjustment. They are never severe negatives. They're usually cleansing reactions. A very commonplace reaction that I have observed is changes in bowel movements. Many women express changes in the menstrual cycle. Sometimes it'll, an irregular cycle of around 32 to 34 days will back up to 28 and stay at 28. Sometimes the reverse happens. But they are often physiological cycles of that kind or cleansing reactions. Some people will tell you, I just was so tired, I don't think I can keep this up. I had to go to work afterwards and I couldn't do a day's work. I was falling asleep on the job. And you have to reassure them that if it is an adjustment reaction, it's not going to keep happening every time they come in. When I was going to Palmer College, I dated a lady. Like most Palmer students, we didn't have money to go out on dates. So we'd sit home and played hearts. We sit around eating popcorn and drinking Kool-Aid, the only things we could afford, and playing hearts. We're sitting there playing hearts one night, and my lady is, yeah, you remember, huh? My lady's sitting next to me, and I said, it's your turn, and she's fast asleep. Fast asleep. It's the first time she got a spine check that day. Here was I, new in the student clinic, and she was my first patient. I checked her spine, adjusted, and she fell asleep right in the middle of the card game. So this tiredness and falling asleep is a very common adjustment reaction. Another one is thirst. People say, I don't know what you did. I couldn't stop drinking. You don't have to tell people drink 8 to 10 glasses of water a day. That's a wrong number to start with. And much more important, their body knows what they should eat or drink during the day. So that's another typical adjustment reaction. Sometimes the reverse happens, especially with kids. Parents will say, for God's sake, turn him down. Can't control it. If he's going to be like this after every time he comes here, I'm just going to have to stop bringing him. Fortunately, that kind of thing doesn't go on forever, and they kind of level out at a higher energy level than they were before. All right, so that's our adjustment reaction. The next thing we have to talk about in the onset of new symptoms is a very well-known but rarely seen chiropractic phenomenon called retracing. Now, let's understand. You're very seldom going to see somebody going through retracing symptoms, and it's a fabulous cop-out for chiropractors who don't understand philosophy at all and want to pretend to the patients they understand why they suddenly went through some changes and got sick. Oh, you're retracing. In order to go from the top of the hill all the way down to the bottom, let's say your house is at the top of the hill, you have to leave your house and you go past the phone booth and 2 light poles and then the greenhouse and the red house and the cemetery. And you walk all the way down past those things. To get back up to the top of the hill, to go home again, you have to go past the cemetery and the greenhouse and the red house and the this and that. All the things you passed, you have to pass in reverse order. That's what retracing is all about. It's a revisitation of those old landmarks. As you left total health to go downhill in sickness and disease long before chiropractic, you passed certain milestones. On the way back, you have to go through those same milestones. Now, most of the time, you're going to go back through them quickly, smoothly, and not even notice them. Every once in a while, however, you will pause at one of those milestones, and the person will observe that particular phenomenon. Some have tried to explain it as being a mental factor, that in getting sick, you establish certain memory pathways in your brain, certain physiological changes in the substance of the brain, and as you go back to health, you go over those pathways again, and that causes a visitation of symptoms, but they are perhaps psychosomatic. In some cases, maybe they are, who knows? I prefer a more simple physiological explanation because it's easier for me to understand, though it's not necessarily more true. I would suggest that retracing probably could be explained many different ways, each of them one contributory factor. The way I like to talk about it is to talk about trying to cultivate bacteria. Now, anybody who's worked in the lab knows that cultivating bacteria in a laboratory is not quite as easy as it sounds. Everything must be done perfectly. First of all, you must have the right medium. Without that, the bacteria won't survive. You must have the right temperature, the right humidity, the right pH. Everything must be right, then you can raise a colony of bacteria. And of course, the same is true in the body. In fact, the environment in the body is not particularly good for bacteria to cultivate and grow. One of the areas that's particularly bad is the area around the kidney. The kidney has an average pH, I believe, of about 5.8, which is much too acid for most types of bacteria. But supposing you become subluxated, your body chemistry begins to change. Let's say the pH at the kidney doesn't stay at 5.8. It becomes a little less acid. It becomes 5.9, 6.0, 6.1. Somewhere along the way there, it is sufficiently alkali or less acid that bacteria can grow there and be cultivated, and you get kidney infection because you've set up a perfect environment for kidneys to grow. Now, what do you do when you get a kidney infection? Well, everybody shoots up with penicillin. Now, it kills all the bacteria, takes away the symptoms, and you're free to go on down toward the cemetery symptom-free. Except because the pH is still still around 6.1, 6.2, whatever it is, you get another kidney infection. And people who get kidney infections always seem to get another one, and the MDs always blame it on the bacteria, in which case, why the hell is it always the left kidney? You think they're all left-handed bacteria? Have you noticed that people who get these infections get them again and again in the same place? And you say, oh, the bacteria keep coming back. Why do they keep coming back to that one kidney? Because that's the one that's the perfect environment for the development of the bacterial colony. And they shoot them up with penicillin and again it works. And it happens a third time, and after a while, maybe after 3 infections, now there are no more. Now that area has become so alkali that the bacteria can't survive. Now they're so sick, even the bacteria can't live in them. Eventually, they're going to come down with acute glomerulonephritis or some other kidney disease, but they never have any more bacteria until you come along. And what do? You help the body to rebalance its chemistry. You help that pH of the kidney to go from 6.2, where it is when you interfere, back to 5.8, where it belongs. The only trouble is, to get from 6.2 to 5.8, it has to go through 6.1, 6.0, 5.9, and all the points in between. During those times, what do you think could happen? You're damn right. They could get another kidney infection. I haven't had one of those in 12 years. You made me sick. That would be a classic retracing example. Not adjustment reaction. Adjustment reaction happens immediately after the first visit. Retracing could happen after months or even years of chiropractic as their body slowly rechanges its physiology, reorganizes its physiology from its sickest level when they first came to see you back towards its most normal level. Now, it may never get all the way back to where it should. The body can only heal as far as the body can heal. It may never get all the way to 5.8. Hey, supposing you get stuck at 6.0, then they're always going to have kidney infections again. Not your fault. You didn't make them sick. If you want to get rid of the kidney infection, subluxate them again. Throw them back to 6.2. No more infections. Sure, they'll die of glomerulonephritis 10 years down the line, but at least they won't have any infections. You cannot be responsible for the state of a patient's health. The only thing you can be responsible for is their state of vertebral subluxation or lack of. That's all we're in business for, is to keep those life channels open. So retracing then is another phenomenon. Well, the question often comes up is, well, should you warn the patients about this? Should you tell them about retracing? My feeling is no. And the reason I say that is people can be so suggestive that if you warn them that something like that could happen, half of them are going to go home and develop it out of fear that it'll happen. Well, I better get those infections again. And they'll go home, and sure enough, they get the infections here. People are suggestive. Yeah, you remember in chiropractic college, every time you discuss a disease, there was one guy who always came down with it. Got so bad that they would discuss syphilis, he wouldn't even come to class. But people can be suggestive. And I personally feel I don't want to talk to them about retracing because it is such a rare thing. Furthermore, if they ever get a retracing symptom, I may recognize the symptom, or they might, but I wouldn't know whether it's retracing or totally separate. That's the trouble with retracing. Fortunately, most people don't experience the symptoms of it. They all go through the levels. The vast majority have no knowledge, no recurrence of actual symptoms. I've had, when I've explained this retracing, chiropractors have asked me, well, supposing the person has had a heart attack, does that mean on the way back to health they're going to have another heart attack? No, a heart attack is not a disease. It's a result of. That's an event resulting from a gradual disease process. Yeah, but what about these people who get a heart attack who've never been sick before? Oh, they've been sick all right. They just didn't know it. The purpose of the innate intelligence is life. 100% life, 100% health. That's what it's working for constantly. There is never a circumstance in which the innate intelligence will harm the structures through which it expresses. Never will the innate intelligence on the path back to health and life cause disease. It may allow symptoms to develop, but that's very different from causing disease. I was asked by a student at one of the chiropractic colleges a couple of years ago, well, when you open up those life channels, you let all that energy flow through, supposing a person has had the nerve energy to the heart partially choked off for years, getting worse and worse and worse, and it's adapted gradually and slowly over the years. Now, after 15 years of getting by under this depleted energy, you come along, you open the channels, you send through a surge of energy. Can't that kill the person? Blow out the valves, cause a heart attack, all that energy coming through at once? Answer? When you open up the channels, you're not shooting a charge of energy through there. What you're doing is restoring control to the innate intelligence. You're allowing the innate intelligence to create as many mental impulses for that body part as are needed by that body part. This is not a constant flow of impulses. Innate's last name is intelligence. It intelligently creates mental impulses. From what does it make these innate forces? It makes them from universal forces by adapting them for use within the body. And it will send through just as many impulses at whatever strength the body can most perfectly use. The whole idea of chiropractic is to trust the innate intelligence to know what it's doing. That's what our deductive reasoning is all about. We say that all the inductive minds, all the knowledge of all the scientists in the world put together, don't know a damn thing about your body or mine individually. We know about all bodies, but know nothing about mine. We could measure, if science was so inclined, could measure how many voltages or how many amperes or whatever it is of electricity a 200-pound man would send from brain to all parts of the body in a 24-hour period. They could measure that. They'd measure it in 10,000 people to take the average. And that doesn't say one thing about what impulses my heart needs at this moment. That knowledge is known only to the innate intelligence. Using the brain as a computer and also using the brain as the generator of electricity or the transformer of electricity, the innate intelligence will send to the heart exactly the right quantity and quality of energy that it needs at any given moment and will never under any circumstances harm the structures within which it works. Retracing, though it may give the evidence of a recurrence of a disease, is in fact a step on the road back to health. All right, last one. The last thing that is going to cause symptoms to appear, new symptoms in a patient. We don't like to talk about it. We much rather pretend it doesn't happen, but it does happen. And it's called technique trauma. Let's understand, first of all, that no adjustment ever, under any circumstances, could cause harm. It is absolutely impossible for an adjustment to cause harm. Adjustment, by definition, is the action of the innate intelligence using its own muscles to correct a vertebral subluxation, thus opening up nerve channels. That can never be damaging. However, the technique employed could be damaging. I remember once having a woman brought to my office by an obstetrician who had tried a lumbar roll on her spine. She was early in her 9th month of pregnancy, and she was complaining of backaches, and asked him, should I go to the chiropractor? This is the obstetrician up on the other corner. Should I go to the chiropractor? And he said, no, I can do it. He does. I can do it better. I'm an MD. So he put her on the table and tried to give her a lumbar roll up on his examining table. Result, she couldn't get off the table. And he had some assistants carry her out of his office into his car and bring her down into my office to try and undo the damage that he'd done. It's very easy to do damage with sloppy technique. We've been hearing some complaints lodged against chiropractors by the medical profession recently, saying that chiropractic can cause tearing of the cervical arteries. Nonsense. Chiropractic can't cause that. I guess some chiropractors could. Some techniques possibly could. Let's talk a little bit about technique trauma. Remember, the perfect technique must be that technique which offers the body the least amount of energy that it needs to convert into an adjustment. You make it the least amount by accurate positioning. The more accurate your positioning, the more accurate your line of drive, the more accurate your analysis, in other words, the more you can reduce your force to absolute minimum. Let's learn one thing from our medical friends. In the Oath of Hippocrates, the credo of medical practice, first, cause no harm. Now, they don't do it, but damn it, we should. First responsibility of a chiropractor should be to cause no harm. Not every vertebral subluxation is going to respond to your technique, to my technique, or perhaps to any technique. But at least let's make sure we don't do any harm. Let us never put enough force into a spine to do damage. You hear about fractured ribs and collapsing vertebrae and radiation of thousands of people, so you find any who have osteoporosis. Good technique should be totally, absolutely safe. I tell my students, you treat every human being who walks into that office as though they're 93 years old and have osteoporosis in every vertebra. You should have a technique so gentle that it could not possibly cause damage in anybody. And if your technique is not that gentle and not that good, maybe we should spend more time learning chiropractic and a damn sight less time learning medical diagnosis, vitamin therapy, and a whole bunch of other things. Our first responsibility as chiropractors must be to have a technique which is safe, first of all, and second, effective. We have to develop criteria for determining when and where to introduce our force, and then reduce the force to its absolute irreducible minimum. And that means total relaxation and acceptance of the patient. Remember, people who come into your office are not coming to you as the first human being who's had contact with their health or their body. They were raised with dentists and physicians and vaccinations and nurses. They've been probed and pushed at and shoved on and hurt. This will only just sting for a second, liar. Wham, in goes the needle. The arm is sore for 5 days. We have been lied to by the medical profession so much that we've become gun-shy. And all of the public who come to you have been that route. And they get on your table. They have no idea of what to expect. First of all, just put yourself in their shoes. Getting on this bloody great table that then goes down, and there's all this machinery and equipment around, and there's 240-pound, 6'4" chiropractor, and all your friends have said, he's not going to hurt you, right? I'm not quite sure you're ready to relax as much as you should. A patient who is not relaxed will take your gentle force and put a massive thrust against it. And the chiropractor says, oh, you're fighting me. I'll do it a little harder. We try and go faster and we finish up going harder. This is counterproductive. Every negative experience they have with you, if you put in your little gentle force and it wasn't enough, don't get greedy. Maybe it was enough for that day. Say, oh shit, I missed, and go back and do it again. And don't yell at the patient, it's your fault, they didn't relax. And don't ever, under any circumstances, use these ripping moves that put forces into several vertebrae at the same time. If you put forces into several vertebrae at the same time, which one is going to move? Oh, that's easy. The most freely movable, meaning the one that's not subluxated. You can make all kinds of pretty ripping sounds, and still the subluxation is there. But first you've got to have a criterion for determining the presence or absence of subluxation. Then you've got to have a technique which is gentle, but still effective. Next week or the week after, we're going to talk a whole lot more about technique. But to avoid technique trauma, let's do certain things. One, please, never, never, never thrust against resistance. If the person is resisting, back off. And then try another time when they're a little more relaxed. And pretty soon, if you keep doing that, if you keep refusing to put forces in there against resistance, pretty soon they're going to realize you're not going to hurt them, and they'll let that resistance go. And then don't punish them by jumping on them with both feet. You see? When they let go, you're going to find that that tiny little bit of force that you were using was enough anyway. If it's accurately placed. Hey, if you're inaccurate in your analysis or your use of leverage, if you don't understand the laws of physics, or you use general racking, twisting moves, then you're going to have to use a whole lot more force. But if you can reduce the force to its minimum by selecting exactly the point where the body can utilize it, that takes very little force at all, provided you know what you're doing. If you have no idea what you're doing, then if your only goal in life is to make things go snap, crackle, pop, then of course you're going to get technique traumas. And the only thing I can suggest then is if you do have somebody with a technique trauma, and really you shouldn't ever get, the only time you should get a technique trauma is if the person is totally relaxed and then they fool you on the timing. And just as you make your tiny little thrust, they buck or pull the other way, and it's their force that will cause the trauma, not yours. That can happen, but boy, it's not going to happen very often. If your technique is gentle enough, they're going to learn to accept that, and they won't resist it nearly as much as if you use abrupt, violent moves. I don't think there should ever be a move used that does not stabilize the rest of the spine. All parts of the spine should be stabilized except the one single segment in which you're trying to put your force. If you put the force into 2 or 3, then obviously you've got to use a lot more force. I guess pretty soon we're going to have to talk a little bit more about this analytical procedure that we talked about, letting the body's own muscles tell you exactly the location and the direction by which the innate intelligence will move that vertebra, use its muscles to make the adjustment. Well, if you can duplicate that, it barely takes a touch. Remember, you're not trying to push a vertebra. When your car gets stuck in the snow and ice, you don't try and push that 10-ton truck, do you? Well, I do. I get my shoulder behind it. Yes, but the truck has its own engine. You ever try and push a truck when its engine is not running? No, what you do when your car is stuck in the snow and ice, you have somebody behind the wheel supplying a little gas, and what you're doing is giving a little gentle direction to help it with traction. You give it a little direction. The engine of the car pulls it. That's what the adjustment is all about. You're giving a little direction. The engine of the bone, the muscle attached to it, supplies the motive power and actually makes the adjustment. You should never be using enough force to move a vertebra. Only enough force so that added to the internal force the body's already generating, the two together can become an adjustment. And boy, if you do that, your technique trauma is almost zero. The only time it's going to happen anyway, a technique trauma, is when the patient fools you and pulls his head or his body out of the way, and usually it's the head and neck that'll do it. Or if you allow yourself to get distracted. You know, that split second when you're coming through with your thrust, somebody's talking to you, or you're worrying about the patient who just left. In most chiropractors' offices, I mean, aside from all the bullshit time and the phony time, the real time that you're spending in technique can be measured in seconds. Certainly the adjustic thrust itself is in seconds, split seconds. Perhaps on the table, actually doing your technique, you're about a minute and a half. Maybe your analysis takes a little longer depending on the analytical procedure you use. You're not with that patient very long. I don't know how much an hour you get paid for your time, but I do know that the very least those patients can expect of you during that time for which you're so highly paid is your total concentration. When Mrs. Jones gets off the table, you must forget her spine, her problems, and concentrate on Mr. Smith, who is now on the table. Total concentration without interruption is absolutely essential to the avoidance of technique trauma. Concentrating on what is that body telling you. You've got to tune into a human being's body and know when they're ready to receive and convert a thrust. BJ improperly described it as innate to innate contact. Improperly because he's talking about innate intelligence, and it's really your trained, educated mind that's doing the job. It's intuitive, just like somebody doing fast typing. That's not innate, they learned it. They do it often enough, it becomes intuitive. You don't think and concentrate on which muscle is doing what, but you just let that person's body, that person's muscles take over and inform your muscles, and somehow you establish a rapport between their physical presence, their energy level, and your physical presence and your energy level, and you don't even know when that thrust is coming through. If you're concentrating, if you're worrying about what the kid's doing with your Buick or what's for dinner tonight, then there's no way you can concentrate. But if you will let yourself become totally attuned to that patient's body, sublimate yourself to the needs of that patient, It's almost as though your hands have a life of their own, and they'll just do what is necessary. And I've had students ask me, why did you do it that way on that person? And I've honestly not been able to answer. I just don't, it just felt right. And, you know, for me, that's a good enough answer. It felt right. Students I've seen watch and memorize and try and duplicate positions, and they bend their hand this way, and is my elbow high enough? And as long as you're thinking about it, you can never do it right. You got to feel it. Shut off the mind and open up these other channels, whatever they are. You've already learned. It couldn't work that way if you hadn't learned with the mind first. The typist couldn't do touch typing 80 words a minute without first learning it. You can't just sit down at a typewriter and Innate will take over and tell you where the keys are. Innate doesn't know where the keys are. Innate doesn't care where the keys are. But once you have learned it and you're doing it every day, and most particularly, you become a better chiropractor for that particular patient the more times you work on that person's spine. When a person first comes to me, I'm tempted to do very little on them the first day because I don't know anything about them. Later on, I know their moods and their compression. They know my touch. We can work together. And the more we work together, the better we become as a team. I think that chiropractic is not something you do to somebody's body. It's something that they and you share to transfer an educatedly derived and refined universal force for the availability of their innate intelligence to convert into an adjustment. That's the best way I can describe it. And only when it's done on that level, that conscious tuning in, sublimating yourself to another human being, only then are you going to be totally free from the dangers of technique trauma. Then, if they ever do get the idea to buck or tense up or something happens, they'll communicate that to you in time to stop your thrust from going in anyway. Please tell your CAs, if anybody, you know, when technique trauma happens, very often the patient doesn't say anything to you. They don't want to hurt your feelings. They're going to go out and they may say something in the waiting room, which is great for your practice. He was a little rough today. Huh? That's all you need. Now if somebody comes to them in the afternoon and says, hey, you want to go bowling? No, I can't. I went to the chiropractor today. I have a headache. Huh? Not very good for you or for chiropractic. Please have your CAs understand that if they catch any sign of anything like that in the reception room, they should just have the patient sit down and wait a minute and you'll check them again. Sometimes just resting your hands, checking their neck, reassuring them that they are not subluxated may be all they need. Maybe, I don't know, maybe a force wasn't properly used and they are still subluxated. Maybe they just need to rest for 10 minutes and they'll clear it out. Whatever it is, if you hear any part of it, give them the opportunity to know that you care. It is important that you care about your patients. Unfortunately, it's also important that you let them know that you care. Not by your words, but by what you do. Let's make a point of doing everything we possibly can to reduce technique trauma to the irreducible minimum. Thank you.